Hello there, my lovely. Make yourself comfortable. My name's Dr. Sarah. Could you just confirm your name for me? Okay, that's perfect. Just going to check the notes I have here from when you called in earlier. Okay, so I believe you've been experiencing some ear pressure and pain, some discomfort around the ears. Yeah? Okay. Alright, and how long has this been going on for? Okay, about a week, okay. Okay. Do you have a history of problems with your ears? Okay. Wax buildup, okay. Okay, do you have any other symptoms? Nasal congestion, fevers, sore throat? Just a bit of headache. Okay, a little bit dizzy. Alright, okay. Okay. Right. So has this been affecting your ability to work or function? A couple of days. The recent days, yeah. Okay. Well, given that you've got a history of problems with your ears and wax build-up, obviously I need to check you out, and if there's anything there that I can remove, I'll remove it for you today. Alright? Okay, do you have a latex allergy at all? No. Okay, that's fine. Right. Let's get some gloves. These are latex gloves, that's why I asked you about the allergy. We do have alternatives. Okay. Right, that's those on. First thing I'll do is just check your lymph nodes around your neck, my lovely. Just keep nice and still for me. Just going to have a little press around. Okay, just behind your head. Okay, anything tender there? Okay, I can't feel anything unusual, so that's good. Okay, I'll just feel across your collarbone area. Okay, that's fine. Right, I'll gently wipe around the ears before I take a close look at them. Okay. Right. Got some lovely wipes here, nice and cool and refreshing. Alright. Keep nice and still for me. I'll just have a gentle wipe on your left ear. You like that? Good. Get another wipe. Okay. Let's take a look at your right ear now. Okay, so I'm going to have a press around on the outer ear. Okay, tell me if anything's uncomfortable at any point. Alright? Okay, I'll just be sort of feeling around and having little pinchy movements and just gently tugging on the ear, okay? That can just indicate how much pain you're getting or if it's a sign of infection, okay? But also be looking very closely for any signs of unusual skin details, lumps, bumps, anything like that, alright? Here we go with your left ear now, my lovely. Okay. I couldn't feel anything unusual there. How did that feel? Just a little bit sore. Okay. Okay, how was that? Okay, a tiny bit uncomfortable again. Okay, right, let me just make a little note of that. Alright. Okay. I'll just quickly take your temperature before I look down your ear, okay? I'm just going to pop in the thermometer. Just hear some beeps, okay? You'll be pleased to know that your temperature is perfectly normal, so that's good news. Okay, it's at 36.9, so that's really good. Okay, so what I'm going to do now, my lovely, is I'm going to use this otoscope here and just going to pop it down each ear and have a little look at what's going on, alright? I need you to keep very, very still for me, but please pop up your hand if anything isn't too uncomfortable for you, alright? Okay, just turn that on. Right, there we go. And it's got a little light on it, and you can see the light. It helps me see right down your ear. Okay, perfect. So, I'll be very gentle, don't worry. Here we go, going in now. There we go. a lot of impacted wax down here, so I am going to remove that. A little bit of redness in the ear canal, but I can't see beyond that right now, so I'll just remove that. Okay. How was that? Alright, okay. And again on this side, just pulling up and back and popping that in there now, Mother. Lots of wax yet again, and some slight redness. Can't see much else, so I'm going to need to remove that wax. Just pull that out now. Well done. Okay, just going to make a note. So we've got wax, paction, both ears, slight erythema in both auditory canals. Okay. Right. So what I'm going to do is put some really lovely drops down your ears. They're my patients' favourite drops. They all love them. And they fizz and crackle a little bit, but they work through the wax and break it down, so it's a lot softer and easy to remove. Okay? Right. Have you had these kind of drops before? Yes, they're very similar to the ones that you could get at the pharmacy, but these are a little bit stronger. Okay. Give them a nice shake. Just make sure they're nicely mixed. You just need a couple of drops in each ear, but they won't sting or burn. Right. I often get asked that, is this going to hurt? But no, these won't. Okay, I'll start with your right ear. So here's one, and two, can you hear the sound? Good. That means it's breaking through all of that wax for me. Here's one, and two, dripping on both sides now? Good, perfect. Alright, let me just make a note of what I've administered there. Okay. How are you doing? Good, good. Okay, so what I'm going to use is a little extraction tool. I'm just finding one that I think will be better suited to what I'm seeing down there. Okay. So I'm going to use this little spoon-shaped tool to just scoop out the wax that I can. I've also got two types of brushes here. I've got a soft brush and more of a metallic type of brush, and they both work in slightly different ways just to remove any excess wax after I've had a little go with the scoop. Is that alright? Again, if anything's uncomfortable, please just pop up your hand, but do keep still because I don't want to injure your ear in any way. Alright? Okay, so we'll start with your left ear, and I'll just have a little scrape around, make sure I've got something to put the wax on there. That's perfect. Okay. Right, here we go. Nice and still for me. Just going to go in with the softer brush at first. Okay. Right. Here we go. different type of brush. Okay, this might feel and sound a little bit different. Okay, lovely. Just going to take a little look down there now. Okay, just with the otoscope again, very quickly. Just popping that in now. Okay. That is looking so much better. And your eardrum looks fine, but you had a very, very nasty impaction down there, but we've successfully removed it, which is perfect. I'm happy with that. Just remove that. Okay. I'm just going to move over to your right ear now and do the same. Are you okay? You're not dizzy or anything? Perfect. Remember, pop up your hand if you're uncomfortable. Okay. Right. Just put my things down there. Right, so I'm going to start with the scraping again now, okay? To have removed a lot there, so I'm just going to go in with the soft brush just for that. this job off properly. I like to do a thorough job, of course. Another look down with the otoscope now. Nearly done, my lovely. You've done fantastically well. Okay, here we go, just popping this in. Okay, that's much cleaner now. I think the little bit of redness in the ear canal will soon calm down now that wax is gone. There's no infection. And the eardrum looks perfectly healthy, as do the structures behind. Both ears are perfectly fine. And you will need to just keep an eye on your wax build-ups though. Okay, I'll withdraw that now. Alright, how are you feeling? Good, good. Let me just make a little note of what I've done there. Alright, just have a little relax. I'm going to put you some very nice cooling drops down your ears in a moment. Okay, do you pay for your prescriptions? Okay, so just pop to the pharmacy and get some olive oil eardrops, alright? Use those daily, they will help soften any wax that's in there, alright? You don't need to start using them just yet. Leave it a little while, leave it a couple of weeks, and then just use a little bit of that, okay? I'll ask you to come back in about 4 weeks' time and we'll check your ears again to make sure that they're not getting blocked up too quickly or that the olive oil is working well. Alright, you do seem to produce a lot of wax naturally, which some people do, but obviously if it impacts regularly you run the risk of getting more pain and infection in the end, okay? So just ask at the pharmacy, they'll know what you need if you just say olive oil eardrops. Okay, right then, so talking of eardrops, got some nice soothing ones as promised. Okay, just put a couple in each ear before you go. You're not dizzy or anything? Perfect. Okay. Right. So here's one and two. They're lovely, aren't they? And here's one. And two. Perfect. Okay then, my lovely. If you're feeling well and happy, then you're free to go. Okay, don't forget to get your olive oil eardrops and make an appointment for 4 weeks' time with the receptionist, and we'll just keep a check on you because I think we just need to do that. All right. Okay. Well, enjoy the rest of your day now. Okay, take care. Bye-bye. Oh, hello there, my lovely. Make yourself comfortable. My name's Dr. Sarah. Pleased to meet you. So what brings you to me today? Okay, so you've got a very, very painful throat and painful ears. All right. Do you have any pain in your sinuses, your headache? Okay. Any body aches, chills? All right. How long have you been feeling like this? Okay. So it's gradually got worse over the past couple of days. Okay. Have you had any problems with your throat before? I can't see on our system. Okay. All right. So have you been taking any medication? Just some paracetamol. Have you been drinking lots of fluid too? Okay. And just having a few throat lozenges. All right, that's fine. Okay. Well, I'm going to take a look at you so we can work out what's going on. It does sound like there's some sort of infection going on there. Okay. Right. I'll just need to do a few little checks. Are you allergic to latex at all? No? Okay. Perfect. Put some gloves on then. It's very cold outside today, and unfortunately we are seeing a lot of infections at the moment. Lots of colds, flus, throat infections, that kind of thing at the minute. It's that time of year, unfortunately. Do you work in an office or a place where there's lots of people around you? Right, okay, yeah. So it's obviously very easy for you to pick up other infections if people are around you that are poorly. Yeah, yeah. Okay, well, let's take a little look at you. Let's have a look at that throat first. I'm just going to get this together. Okay, so this is a laryngoscope. It has a light. Okay, and I'll just have to depress your tongue very slightly. I'm sorry, I know that's not too comfortable. And I can take a good look down the throat there and see what looks inflamed. Okay? Alright, I'll just get a fresh tongue depressor. Just breathe through your nose while I do this if you can, okay? It just helps suppress the gag reflex, which is always worse when you've got a sore throat, isn't it? And if things are swollen. So I'll be as quick as possible and as gentle as possible, okay? Alright. Okay then. Alright, my lovely. So open nice and wide for me. There we go, that's perfect. Just coming in now. Okay, can you say R for me? Okay. And again. Okay, I'm just going to come a little bit closer. Okay, just going to pop this back in. Okay. Just say R for me again. Okay, just relax there, well done. Okay, right, just going to change the tip now for the otoscope. Alright, so what I'm seeing there is a very, very inflamed throat. Your tonsils are looking swollen. They do have some little spots on them, which is indicative of something like tonsillitis or strep throat. Okay. Strep throat is a bacterial infection which makes you feel very, very poorly and gives you a really sore throat and a very swollen throat. And the symptoms that you've been getting really, okay, can give you pain in your ears, it can make you feel feverish, achy, tired, really, really unwell. Okay, so you've done the right thing by coming here today. Okay, so I want to take your temperature. Just get a new tip for that. Okay, perfect. So I'll just insert this into your ear. I know your ears are painful, so I'll be very gentle, okay? You'll just hear a couple of beeps, alright? Here we go. Just popping that in now. Okay then, my lovely. Well, you do have a high temperature. It's 37.9, so it's higher than it should be. Okay, so you do have a little bit of a fever there. Alright, so I'll just make a note of that. Have you taken any paracetamol this morning? You have, okay, because that can lower your temperature a little bit, so maybe your temperature would be even higher without that. But that does show me that there's some infection there. Okay. So I'm just going to have a little press around your neck, my lovely, to check the lymph nodes, alright? Tell me if anything feels particularly painful. I'm just checking for swollen lymph nodes, which can indicate infection also. Okay? Alright then. Just relax. Anything feel sore there? Okay. Okay. You do feel a little bit swollen. Yeah, not too bad, but I can feel a couple of lymph nodes that are swollen down your neck, alright. Just make some notes. Right. Okay. So I'll have a little look inside your ears if that's alright, my lovely. I'll be very, very gentle, okay? Perfect. Okay. So now I'm going to use the otoscope. Okay, you've probably seen one of these many times, yeah? Again, it has a light, and I'll just gently insert it into the ear canal, okay? Keep very, very still for me while I do this. If anything is uncomfortable, please pop up your hand, okay? Alright. So we'll start with your left ear, okay? So, here we go. I'm just gently going to insert this now. There we go. Okay. So I can see some fluid behind the eardrum there. There are some little bubbles. Okay. It looks a little bit angry down there, so I suspect the infection is in your ears as well. which is common. Right, I'm just going to blow a little puff of air into your ear canal. This will just let me see how well the eardrum is moving. Okay, here we go. Okay. Yeah, it's quite bulgy and not moving too well, so there's too much fluid build up behind there. Just have another look now. Okay, let me just take that out of there. Well done. Okay. Are you alright there? Let's take a little look down at this one. And I'm just going to insert that now. Okay, here we go. There we go, lovely, well done. Okay. Yeah, looking very similar on this side. Fluid behind the eardrum looking quite inflamed down there, so let me just puff a little bit of air in this side too. Here we go. Okay, and take another look. Alright, I know this is rather painful, so I'm not going to spend any longer down here than necessary. Okay. Take that out. Alright. You okay? Good. Right then. While I've got the otoscope, I'm just going to have a little look up your nostrils, alright? Have you been sneezing at all? Okay, so I'm just going to insert the tip just inside the nose there, but I'll just have to push very gently on your nose as I do so, alright? Just keep nice and still for me, my lovely. Okay, thank you. Here we go. Perfect. Okay. Yeah, looking a little bit red up there too. A little bit of discharge. Okay. And this side. Excellent. Let's just take a look. Okay. Alright. That's enough of that, isn't it? Okay. Just relax. Just take that tip off. I can go over there. Okay. So I'll have a little palpate around your ears just to make sure that there's nothing going on with the outer ear. Okay, because infection can spread and cause a lot of irritation and inflammation. If anything is painful, please let me know. You may feel some discomfort because your ear canals and eardrum are infected. Alright? Okay. I'll be very gentle. Here we go. Just gently pressing around. How's that? Okay. Just a gentle little pull there on the ear. Is that painful? Yeah, okay. Sorry about that. Okay. So the soreness that you're experiencing, I would expect, given the infection you've got going on, but I couldn't feel anything untoward. All right? Okay, here we go with this side. Just a little ball here there. Okay. Okay, my lovely. So what I'd like to do next is just have a little listen to your chest, if I may. Sometimes these infections can spread down into the chest. Have you had any tightness in the chest or coughing? Okay, not at the moment. Okay, well that's good. Let me just have a little listen. Okay. Okay. Just going to pop the stethoscope onto your chest, all right? Okay, there we go. And can you take a nice breath in for me? Okay, and out. And again, in. And out. Keep that up now. Again. Again. Lovely. And again. And again. Okay. Just going to lean round the back a second. Okay. And deep breath in. And out. Lovely. And again. Okay. And round this side. In. And out. Okay. And in. And out. Okay. Just breathe normally now for me. Okay. And could you give me a little cough? Okay, and again. Okay. Well, that all sounds perfect. I'll just check your blood pressure while I've got the stethoscope here. Okay. There we go. So I'm just going to pop the cuff around your arm and inflate it. All right. It will go tight. I'm sure you've had this done before. Yeah. Just want to check it, particularly when you've got an infection. Okay. It's just good to check. So there we go. Right, let's put that around there. Okay, here we go. Just got to pop the stethoscope underneath and just going to inflate that now, alright? Just breathe normally for me. Okay. Your blood pressure is fine. Okay, take that off. Right, that's more comfortable now, isn't it? Yeah. Okay. Right, don't need the stethoscope anymore. I'll just jot a few notes down. So I'd like to take a couple of swabs if I may, okay? I'm going to take a swab of your ear and also one of your throat, okay? Different swabs, don't worry, it won't be the same one, alright? Ready? Okay. So I'm just going to gently wipe this swab around the inside of your ear, alright? Be very, very gentle because I know you're very pained there, okay? Okay, here we go. Very gently, just wipe that. Alright, well done. Just pop that in there. Okay. And I also want to take one of your throat. So I need to get another swab. I will get you on some antibiotics, but by doing the swab we can get a proper idea of what bacteria is in your throat, just in case we need to change the antibiotics. Okay, right. So I just need you to open wide for me, my lovely, okay? Just have a quick look with my light. Right, that's fine. Nice and wide. Okay, here we go. Swab round. I know it's very comfortable. Be very quick. Just breathe through your nose. There we go. That's done. You're right. Good. Okay. How are you feeling at the moment? Alright. I'll just take a little press around your sinuses if that's okay. It's just good for me to have a little feel of what's going on there, alright? So, does that feel tender? Yeah, a little bit? Okay. And what about at the top here? Yeah? Alright. Okay. So, as I said, I'm going to get those swabs sent off just to see what's going on. I'm going to give you an antibiotic. You're not allergic to penicillin, are you? No, that's good. I'm going to give you a penicillin antibiotic which should attack what's going on in your throat and also your ears as well. Yeah. Sometimes it's hard to distinguish between viral and bacterial infections, but because this is looking very angry in your throat, yeah, and your ears aren't looking too good either, and you're feeling particularly poorly, I am going to treat this as a bacterial infection. It may have followed on from a viral infection. Alright, but we just don't want to take any chances because your throat is already very, very inflamed. I bet you're having trouble eating, aren't you? Yeah, yeah. Okay. Alright then, so what I'm going to do for you is I'm going to put some soothing drops down your ears. Okay. These will just make them feel a little bit less irritated, and then the antibiotics will attack the infection from the inside. Okay, these won't burn or stink. They'll just make you feel a lot more comfortable. Okay, right, start with your right ear. And just keep nice and still for me. just going to pop a couple of these down each ear. Here we go. Here's one. And two. There we go. Let's get that little massage in. Okay there. Good. So here's one. And two. Just a little massage there. Okay. Alright then, my lovely. Well, I'm just going to do the prescription. Okay, so that's gone over to the pharmacy, so you can collect that on your way out. So, things you can do at home: drink plenty of fluids, whatever's comfortable. If you fancy having an iced lolly, that might help your throat. Equally, some nice warm soup. Don't burn your throat anymore. You know, it's already aggravated, so don't have things too hot, okay? Try and avoid things that are obviously going to make your throat feel irritated, like, you know, scratchy, hard foods as well. Carry on with your paracetamol 4 times a day. Okay. You can also take ibuprofen to help with any inflammation if you can tolerate it. But if you do take that, please make sure you take it with food. Okay? And don't exceed the dose. Alright, it can make your tummy feel a little bit uncomfortable. If it does, you can stop taking it. Alright? But please have it with food because it helps prevent the stomach irritation. Alright? And the antibiotics, they'll start working within 24 hours. Okay, but really keep those fluids going in and rest as much as possible. If you start feeling worse, please either give us a call or go to A&E. Okay? I'm sure that won't happen, but obviously if we're out of hours, please go to A&E if you start feeling really poorly. Okay? Alright. Well, I hope you feel better very soon. I'll give you a call when I've got the swab results just to confirm that you're on the right antibiotic, or if you're not, I'll do a new prescription and we'll get that to you, okay, to change onto. Alright? Okay. Alright, take care.